Hi, my name is Dr. Rudra Mohan, and through the Oral Health channel, today we're going to be talking about why people love Ketorol DT so much. Let's start. So today is a very important episode for me because I speak to a lot of my viewers telephonically and I get to know that they have been diagnosed with some sort of pulpal pain or any sort of wisdom tooth related pain which is very severe and uncontrollable. So in most of the cases, people unfortunately don't go to the dental office because of the pain that they're going through. It's unbearable. It becomes severe on lying down. It's a treatment that requires dental treatment, proper root canal treatment, or wisdom tooth pain, that is basically the extraction of the third molar. But people being people would not want to go to the dental office because of their fear of dentistry or the fact that they feel that dentistry is too expensive. So they choose to go to the medical shop and they ask the medical representative or the pharmacist there to give them something which is a quick fix for their problem and that can help them with the resolution of their issues. So simply what the pharmacist does is give them this medicine which is known as Ketorol DT. Salt of Ketorol DT is actually ketorolactromethamine, which is basically a pyrrolopyrrole derivative which basically inhibits the cyclooxygenase enzyme 1 and 2, thereby decreasing the number of circulating prostaglandins because of inflammation due to infection. So it stops the step where the inflammation releases prostaglandins, and that's why you get that pain relief. Now let me tell you something from a dentist point of view. You are relieving the symptoms, not the cause, because the cause is the infection. It's the dental infection, and that's why you need to mechanically treat the tooth with the help of a root canal or the mechanical removal of a wisdom tooth which has gotten stuck inside your jawbone and causing infection. Now, the most important thing about Ketorol DT is the fact that I want you to understand the safety, the indications, and the contraindications. It is very useful in terms of dental pain relief. An onset of action within the first 120 minutes. It lasts up to 6 hours. It is equivalent to pain relief, almost to the opioid level. But there are some warnings that I would like to give you. You're not supposed to consume more than 4 tablets in 24 hours. That's 40 milligram per day. Each tablet is basically 10 milligrams per day. Why it is very attractive to patients is because of its low price, the fact that it is easily available, at least in the Indian demographic, and the fact it is dispersible and has a decently tolerable taste. To just drink it up with the help of a glass of water and then you will be fine within the first 120 minutes. Since it is dispersible, people have that whole placebo effect going on that it's going to get absorbed faster. But let me tell you what are the contraindications. If you have stomach problems such as renal disease, gastrointestinal bleeding, ulcers, liver disease, and all those things, this dose needs to be modified after the consultation of your physician. At the same time, it is contraindicated in pregnant women, and you have to be proceeding with caution after the consultation with your healthcare physician for breastfeeding women. If you are consuming alcohol, I would strongly recommend not to do this while you're taking this medication, as it can cause gastrointestinal bleeding. At the same time, it has dizziness as a side effect, so you might have more pronounced dizziness after that. If you're planning to operate any heavy machinery or drive a long distance by yourself and you're consuming this tablet, that I would request you to either postpone that trip or not operate the machinery or get someone else to drive for you, because the alertness goes down and you might feel drowsy after that. It's very important for me to reiterate that the medicine will not take care of the disease or the cause. The medicine will just alleviate the symptoms or the effect of the cause, the cause being dental infection. And that's why for dental infection, which is either requiring a root canal treatment or a wisdom tooth surgery, you need to make sure that you go and visit the dentist and get the treatment done. So that's it for today. Thank you.